Hello, I'm Stephanie Best. I'm a researcher and I'm interested in professional identity in health and social care. So, health and social care practitioners, how we think about ourselves is very much influenced by our professional identity. Our sense of our professional self is very much based in our membership of different groups. So, health and social care practitioners can categorise themselves into one profession, like doctors or physios. And then they adopt the social norms of that particular profession, so that becomes their in-group. And our work experiences reinforce these. So we then have a measure that we can compare ourselves to other professions, and that becomes the out-group. So why does this matter? Well, we know that a group's norms influence behaviour. So the collective norms of a profession will impact how people approach their work and how they behave in the workplace. So how most of a profession behaves and what it deems as important is going to be reflected in the actions of each individual practitioner. So in the end, if we think about health and social care, the quality of care that you receive will be dependent on the behaviour of the professional treating you. So we were really interested in knowing what happens when you mix all these professions up into interprofessional groups. So you've got all the in-groups and all the out-groups thrown in together with an expectation that they'll just be able to sort of mobilise or flex their professional identity and the care that they deliver will be improved. So we used a concept called signature pedagogy to investigate health and social care practitioners' experiences when they were working in interprofessional teams. And there are 3 signature pedagogy apprenticeships of learning. To think and to perform like others in their profession, and to act with moral integrity. So think, learn and act. And our study found that health and social care professionals, they can be flexible with their identity in order to maximise their sort of work setting and benefit for patients. And we found the biggest challenge to practitioners in interprofessional teams was around thinking like others in their profession. So why is this interesting? Well, we think it's interesting because it shows that actions needed at all sorts of different levels. Individual health and social care practitioners need to actively engage with their own groups. They can't just sort of passively become members of interprofessional teams' norms. That role of others is so significant, and proactively working with their interdisciplinary colleagues is great and can facilitate a sense of identity if they've got connections to their own group. Organisational leads need to be aware of the opportunities to promote mobilisation of professional identity, to maximise teamwork. So, for example, at sort of inductions and things like that, introducing different roles and shared responsibilities. And then finally, professional bodies and educators have got a significant role in promoting interprofessional education and interprofessional teamwork. Thanks very much for listening.